I'm Danielle Strauss. I'm also one of several managing directors of supportive housing at Harlem United. I manage our New York 3 scattered site housing program and 2 of our congregates, our emergency congregate programs. But what I'm going to talk about today is Harlem United in general, not specifically my program, but our model, how we do rent collection. So a little bit about Harlem United's housing program. With funding from HUD, HOPWA, HRA, HASA, and Public Health Solutions, we have 586 supportive housing units for HIV-positive clients. Within the 586, 509 of those units are for scattered site, and all of our units are located in the Bronx, Manhattan, and Brooklyn. 392 of those units are for permanent housing, and 117 are for transitional housing for up to 2 years. We also have 77 congregate housing units in Manhattan, 53 of which are for permanent housing, and 24 emergency transitional housing for 6 months. In addition to having HIV, all of our clients have histories of homelessness, and most have a mental health diagnosis or a substance abuse diagnosis. Of the 509 scattered site units, we have 144 units designated specifically for women with mental illness or women with children, and we have an additional 39 units for families. The rest are for single adults. So with regard to our rent collection rate, I heard when we were walking in, someone was talking about, this is the $1 million question. How do we collect rent? We have no magic bullet, I'll tell you that much. It's a lot of work. So Harlem United works really hard at collecting rent from our supportive housing clients. Our combined among all of our supportive housing programs for the fiscal year 13, which was July to April, which is the most recent month we have data for. So from July to April 2013, our overall rate has been 80%, which means we've collected 80% of the rent we expected to collect, which is based on the client's income and government guidelines regarding the proportion of their income that's allocated towards rent. For the most part, it's 30%, but that's not for all of our clients. Some clients have to pay a larger portion of their monthly income towards rent. So 80% is our overall rate. The permanent congregate programs tend to do better than the scattered site programs. 95% was our overall rate for the congregate programs compared to an average 76% for the scattered site programs. We don't know exactly why the congregates do better, except for maybe the obvious, which is we have staff on site 7 days a week. We have clinical staff on site 5 days a week. They're there when the checks come in on the first of the month, knocking on clients' doors, collect the rent, as opposed to the scattered site programs, which is more challenging. However, I'm going to get to a little bit later some of the strategies case managers have used to work on that. But there's also we have varied populations within our scattered site programs. So while our overall rate is 76% in scattered site, it could be as low as 62% in one program and as high as 87% in another program, and depends on the population that each scattered site program serves. Who does what? What is the Harlem United model? It's different than my other presenters. Harlem United treats rent collection as an essential component and responsibility of the supportive housing program. We don't have a separate entity, the property management entity, to collect the rent or do the rent administration. It's all done within the supportive housing, the clinical portion. The supportive housing programs, and specifically the case managers, a few of whom are actually sitting in the audience, so I hope I represent your job well. It's a hard job, but it's the case managers who collect the rent directly from the clients. The programs monitor the payments made on a monthly basis, and they track and calculate the rent arrears. So we do the administration aspect of the rent collection as well as the case management aspect of the rent collection. The case managers work closely and directly with all the clients on their caseloads to address their barriers to rent payment based on HASA guidelines for case conferencing, as well as harm reduction principles and motivational interviewing techniques. Let me go back to that. What do I mean by harm reduction? So we treat rent collection as a clinical issue. If a client is not paying their rent, there's something else going on. Mm-hmm. Why are they not prioritizing their housing at this point in time? What are they spending their money on? So the case managers are working with them to identify what those barriers are. Where is that money going? Let's do some money management. Let's do some budgeting. Factoring in the non-traditional sources that their money might be spent on, put that into your budget. However, rent or housing ought to be high up there on your priority list, and then you can put in your recreational budget later. So that's what the case managers do on a monthly basis, and they don't stop. Even when someone is paying rent, that conversation's still there and present in every single monthly home visit. Switching gears back to the administration aspect of it, each program, the supportive housing program, is responsible for mailing a monthly invoice to each client about their rent portion. Just like we would receive in our apartments, I get a little monthly invoice under my door every month telling me that my rent is due or my maintenance payment and the due date. So we do the same thing for our clients. They get how much money they owe for that month, the amount that's past due, so how much do they owe in arrears, and the due date. So they have to be paying rent by the 5th of the month. Clients also receive a receipt from the program when they pay their rent, and we keep copies of the money orders in binders and within the supportive housing program before the check is sent over to finance for deposit. And we enter everything into a tracking sheet. So we have checks and balances. So if a client doesn't believe that they owe that much money in arrears, they have their receipts that they can bring to the office to show us what they've paid. We have our backups electronically and in hard copy. So we will go back and maybe someone did a mathematical error and we'll check it. But for the most part, we try and keep our records straight so that there aren't those confusions. Because the client will say, I don't owe that much. And we'll say, prove it. So this is an example of what a tracking sheet might look like. Basically, like I said, each program is responsible for maintaining it. We call it the client information profile. And on the left column, we list all the clients in the program. Then each month, it's a spreadsheet, so it's all in Excel, and it's all, the formulas are built in. Each month they pay, it automatically accumulates how much they've paid to date, what they're supposed to have paid to date based on their monthly income, and then what their arrears are. And we use this tracking sheet in several ways. It's on a shared drive, so the case managers have access to it and can look up if they don't know if their client paid. Maybe the client mailed in their money order or came to the office to pay and didn't give it to the case manager. He or she can look it up on the spreadsheet to know if their client paid that month or what their client's arrears are so that they can discuss it in the home visits. The supervisors will talk about rent collection in supervision, so they can look up the spreadsheet and see how a particular case manager's caseload is doing around rent collection. Like I said before, we've noticed that the congregate housing programs do a little bit better around rent collection. So one thing that the scattered site program case managers have thought about doing is looking at, on my caseload, who's having more trouble or problems with rent payment, and maybe I should be showing up at their house at the first of the month. Mm-hmm. So they'll schedule their home visits around an individual client or their clients on their caseloads, practice around rent. And the people who are struggling with rent payment, they get seen first in the beginning of the month before the clients spent the money, ideally.
I remember that.
So what do we do if someone's not paying their rent? This is some of our practices. If a client misses one rent payment, they receive a letter by the 7th of the following month explaining the importance of rent payment and the consequences of non-rent payment. And like I said before, and ongoing and always, the case manager is in their face about it, talking to them about rent payment. If a client misses 2 rent payments or accrues rent arrears equaling 200% of their rent portion, which is the equivalent of 2 months of rent, we have a case conference. And during the case conference is specifically to identify and strategize around the barriers to rent payment. Again, based on harm reduction principles, we believe in individuals' right to self-determination. So our job is to discuss with them what the consequences are of non-rent payment is, which is ultimately eviction, which obviously we want to avoid, and then a money payment plan. Going to a money management course might be an option, figuring out where that money is going, possibly going direct payment, opening up a banking account, and having their money be sent directly to Harlem United prior, their rent portion that is, although that hasn't worked entirely well because if the client withdraws their money before the check gets sent, it bounces, and then we have to pay for it. So we have tried that, and it has worked really, really well for some clients, but it has backfired on us also. But in any case, that's what gets covered in the case conference. are really what's going on. And who's present at this case conference? The client ought to be engaged at every step of the way. So obviously the client is invited. They don't always show up. We still have the case conference anyway. The hostel worker is invited, the case manager, a supervisor of the program, and any other staff member with either within Harlem United or an external provider who works with that client, so that we're all on the same page and that we're all collectively working towards the same goal, which is to keep the client housed. One thing, so every case conference concludes with a contract, a behavioral contract if its behavior is an issue around rent payment, as well as that payment plan. If the client continues to miss rent payments, pays inconsistently, or makes partial payments, the eviction process is initiated. It's the last resort. We're not in the business of evicting clients. We got into this business to house homeless clients. However, after all of our strategies have been employed and the client is still reluctant to implement any of these strategies or change their behavior or increase their rent payment, we have no choice but to go to eviction. It's part of the process, and it's holding, like as Seth said earlier, it's holding them accountable. That, other clients are paying rent. Other people in society are paying rent, and, we recognize that there's a lot of struggles in their lives. They don't get that much money in a month. However, rent is part of their responsibility, and they will hold them accountable for it. Also, for our HASA-funded programs, the eviction process is set by HASA, and it requires 3 case conferences, a level 1, 2, and 3, before HASA will approve the eviction. So these are some of the challenges that we find. It's not easy to do this work. As one, having the social service program do it all is challenging. It's wearing a dual hat, as, again, the case managers can speak to probably better than me. The dual role of being the rent collector as well as the supportive housing case manager can interfere with that relationship you have with your client, and it makes it challenging for the case managers to accomplish other aspects of the job, such as care coordination, helping the client address their medical care or their mental health needs. And so that our case managers struggle with that a lot. There's also this challenge administratively around, and this was alluded to before, evictions cost money. It's expensive to go through housing court. However, it's also costs us money not to evict. The reality of our funding today is that as it's becoming more and more difficult for our programs to manage our budgets without that rent collection portion being paid. Rents increase every year. We have leases with landlords. Our budgets are not increasing every single year. We need the rent collection, the client portion, to balance our budgets.